Hello, everyone. I'm Amali Fernando, and I'm one of the organizational advisors for the Loyola Student Response Team. So today I'd like to welcome you to the team, tell you what we do, who we are, and hopefully get you interested and excited in what we do. So first, here's a little background about us, the Student Response Team. We were founded just after the World Health Organization declared COVID-19 a pandemic. And we were actually started by third and fourth year medical students who couldn't do their rotations anymore due to the pandemic, but they still had all of this energy and excitement, wanting to do justice while still learning medicine. So together they started a COVID-19 hotline, and they started organizing meals for frontline providers and really trying to take care of the people that were most vulnerable to COVID-19 and COVID-19 lateral damage. So eventually, all of these separate efforts kind of came together under one umbrella. That's the Student Response Team. And so today I'm going to walk you through a whole bunch of projects that we have going on. But I hope you'll realize that all of our projects have this one unifying goal, which is to respond to the needs of our hospital and our community. And with that goal, we've started so many projects that have just blossomed under this umbrella, and we've accomplished a lot of really wonderful things. So I want to show you this picture. This is from the hotline days, when our third and fourth year students were really a catch-all for all the community questions about COVID-19. And we can see them staying at work to take care of all of us. And since those initial days, the SRT has really changed a lot in its organization. So here's our general structure now. So under this big umbrella of the Student Response Team, we have a clinical assistance division, community support, information sharing, curriculum development, and health justice. And each one of those has got its own projects, and I'd like to walk you through each of them. So we're going to start with information sharing, because they're the ones that put together this document of all of the best practices, what to do in an outpatient setting to keep yourself healthy, to keep your patients healthy. And that information got sent out to all of our third year and our fourth year students. So that was a really big success for the information sharing program. And the curriculum development program is still getting off the ground, and we're starting this journal club because what we know about COVID is constantly evolving, right? So that journal club is going to bring together faculty and students to keep abreast of all of what's going on with COVID. So our three remaining pillars, our clinical assistance, our community support, and our health justice, I want to really dive into, tell you what we've done and how you can get involved. So let's start with clinical assistance. So at the outset of the pandemic, clinical assistance was a hotline, answering all community questions about what is this pandemic, right? There was so much uncertainty at the beginning, and there still is. And in addition to the COVID hotline, they were doing telehealth appointment scheduling. So this was really manned by our M3s and M4s. But in the months of the pandemic, this has transitioned a little bit. So right now, what are we doing? We are doing childcare assistance for faculty and staff at the hospital and at the medical school. And so if this is something you want to get involved in, we'd love your help, doing Zoom tutoring sessions and things for students. We're also making sure that all our pediatric patients are getting the immunizations they need on schedule. So that's something that our third and fourth years are doing as part of their PEDS rotation now. The next thing we're doing, and this is something we need quite a bit of help with, is social needs screening. So patients come to Loyola to get tested. And after that, we not only call them to give them the test results, but they additionally get a call saying, what do you need right now? Do you need help getting food? Do you have a safe place to live? Are you having a hard time paying your rent? Do you need any transportation assistance? All of these things that fit into the bigger picture of health that really so often as medical students, we don't always get a chance to ask our patients about and address. So if a patient screens positive for a social need, we work to connect them to a community resource. And Trinity has this great list of resources, or we can look up resources on our own. So every patient that screens positive, we try and match them to 3 or 4 different resources in the hopes that one will help them meet their need. And of course, we do follow up with patients to make sure that they were able to get some benefit or some help with whatever it is that they needed help with. So it's definitely outside the realm of directly dealing with symptoms, but it's so important in the overall picture of health. And as the number of COVID cases rises, this is something we need help with. So if you have Epic access, please reach out and we'd really love your help in addressing social determinants of health. And then the next thing is specifically for a very vulnerable population, that is the unhoused population. So we're doing daily symptoms grading through Housing Forward. So Housing Forward is an agency that is currently sheltering people in hotels, and we need to be calling them every single day just to keep abreast of their COVID symptoms, as this is a rapidly changing situation. So if you'd like to help us kind of monitor the needs or monitor the symptoms of this vulnerable population to kind of free up housing case managers to do all of the work they need to do, we'd love your help with this as well. So that's clinical assistance in a nutshell. I'd like to move on to community support. And so here's some highlights from what community support has done in the past. You know, masks for Maywood, feeding the front line, and these are art for residents. And here's like a extra special glimpse of the Art for Resident. This program asked kids to contribute art to residents. And this was at the beginning of the pandemic. You know, this was a time of very intense uncertainty. And I think this artwork, to me at least, really showed how connected we were as a community. It was a ray of sunshine in a very, very dark time. And really, community support is all about meeting the needs of our community and working alongside community partners and kind of using our expertise as medical students to support our community in whatever way we can. So how can you get involved with community support? Again, like we mentioned, tutoring for faculty and staff, or the children rather, of faculty and staff via video chat. If you speak Mandarin or Cantonese, we need help with appointment triage and with phone banking, and these are for 2 community partner organizations. Another opportunity, which is very powerful, is expert medical declaration writing. So for this, you'd be partnered with several other students and a resident to write a declaration for people currently in detention. So currently in detention due to ICE, and to provide medical reasons why that detention is unsafe due to higher risk of COVID, and also due to that patient's pre-existing conditions, right? And through this, we have actually been able to get people released from ICE detention. So this is a very powerful opportunity where you can affect a very real, tangible change for families. And then we also need help with our emergency food assistance. So one arm of this project is generating revenue for Housing Forward to use to feed their homeless population. And so these fundraisers, we need not only your help in contributing or donating, but also your help in spreading the word. So those are some ways to get involved with community support. Another way is what you all participated in today, or some of you did, which is the healthcare, the letter writing initiative. So our last arm that I need to talk about is our health justice. So there's a couple pieces of this. The first is contact tracing. So we have a soft skills contact tracing course. And what that does is that gets you ready to not just be a contact tracer, but to be a good contact tracer. Because it is hard to do that kind of screening over the phone, especially when you're asking for somewhat private information, or at least very personal information. So this course walks you through the soft skills of how to do this in a patient-centered manner, in an empathetic manner. And so once you have that soft skills, you're ready to then go serve other local health or public health agencies as a contact tracer. The next thing we need is for our mobile COVID testing van, which actually took off very recently this week. And so this is a large but ambiguous time commitment, right? This is a mobile testing van, which has long days and administers about 50 tests a day. And These mobile testing sites are really a coming together of community resources. So it takes a lot of coordination, not only to run the tests, but also to have all of our other community partners there at the site. So volunteers for this will have to be adaptable and flexible, but also really passionate about our Maywood community and making sure they have access to the tests they need and the resources they need. So this is really an exciting opportunity and one that will continue to unfold in the weeks ahead. So I want to just leave you with this list of actively recruiting initiatives. If anything I said today kind of got you excited, I'd love to hear from you. And we're going to be sending out an email soon of all of these different ways you can get involved and how exactly to do that, because each initiative has a little bit of a different onboarding process. So I want to thank you for your time. Here's one more piece of artwork from our Art for Residents activity. Thank you so much for your time, for listening to this video, and I really hope you choose to get involved with the COVID student response team. It's an opportunity like no other to respond to the needs of the community, to develop your clinical skills, and really to put your leadership and your ideas into practice. So thank you so much for your time, and I look forward to meeting you in person one day soon. Bye-bye.